to understand, at a high level, what, Prime Minister, if I may start with you, you have a heavy portfolio with responsibility for the energy sector in particular. And just before I ask you to give your perspective, to share perspective with the people and the viewers, I want to make a few comments quickly. As I was coming here, I was listening to the opposition leader who was proposing his criticisms to the budget. And he posited that the budget contained nothing for the manufacturing sector, nothing for cost of living, which is not true, because the major project for the manufacturing sector, which he himself highlighted the energy cost, is the gas to shore project. And in the budget, we have in excess of $40 billion allocated to get that project going, which we understand is scheduled to be completed within the time frame. And once that project is materialized, the people of Guyana, the manufacturing sector at the household level as well, are expected to be benefiting from that 50% reduction. So, Prime Minister, please share some of your perspective generally within the energy sector and also on the gas.
Okay, good evening, Joel, and thank you for being on this program. And good evening to the people of Guyana. And I'm here with my colleagues to basically simplify the general thrust of the budget that you would have listened to over the last 5.5 hours of the budget speech. To make it simple, the budget has two main areas. One, dealing with the pressing issues of today. All of us know of the pressing issues of today. And also, the second part is continuing the development trajectory that would have started from the time we assume office. With regards to the energy sector, as you quite rightly said, the big project, I like to refer to as a mega project, because it's the biggest project that we ever had in the history of Guyana. It's going to run over $1.5 billion, right? Definitely over $1.5 billion, and that's the gas to energy project. What will the gas to energy project do for Guyana? It will bring down the cost of electricity for everybody, households and the commercial sector, the businessmen, the same business sector, the commercial sector that Mr. Norton tried to pronounce on earlier. The timeline for the completion of this project, as you know, is December 2024. What it means, by December 2024, we will have electricity from this gas to energy project. Electricity that is far cheaper than what we're paying for today. We're paying somewhere around 25 cents per kilowatt hour today. And by our initial projection, we will be able to supply and sell electricity for less than half of that to the business sector, to the household in Guyana. What does this mean? It means that whatever manufacturing the business sector is into today, in another 2 years, on the completion of this project, they will be able to do so at a far cheaper cost. So there is a lot in there for the business sector. Also, we're not waiting until that project comes on stream. What we're doing, we expect that the business sector will continue to grow. So we are also investing in 50 megawatts of electricity in the short term to ensure that there's enough electrical power in the system to satisfy the need of the growing demand for electricity in Guyana. Not only in the business sector, but there are many unserved and underserved areas that are demanding electrical supply to households in new housing schemes, squatting schemes that are being regularized. They need electricity. So in the short term, we have the 50 megawatt that will provide electricity for the growing demand. And the gas to shore will come on stream, and that will provide electricity that is not only reliable, but is far cheaper than what we're paying for now. And it means that all the business sector, all the households will benefit from that. And that itself will have an effect, a positive effect on economic growth in Guyana. Because more investors will come now, more Guyanese and foreign investors, because now electricity will be cheaper in Guyana.
Certainly. Thank you for that, Prime Minister. And if I may, the gas to energy project is also tied to the regional energy security agenda. And this is something that our government, under the leadership of President His Excellency, is driving this at a regional level. And there is this concern by people and critics, certain media houses, that what are we going to do with the excess supply based on the volume of gas that we have. And they refer to examples in other countries that such projects fail. But you have to look at it from the regional perspective within that context. And if you do so, you would find that the current consumption of natural gas in the region, it's about $1 billion. And if the region is serious, and some countries in the Caribbean are making the investment as a transitional source of energy, and if the region could commit to that over a period of time to invest in the required infrastructure to transition to natural gas, we are talking about a $9 billion US market over the next 15 years that could materialize. So that is also an important context to put it in that regard. Now, Minister Sukhai, close to $5 billion. Could you tell us, give us a little bit of highlight of the main investment, the main projects that will be undertaken in the Amerindian communities for Amerindian development?
Well, good evening, Joel, and good evening to the viewing public and the people who this budget will benefit. First of all, let me say that this budget will benefit. First of all, let me say that this is the largest budget in our history, 781.9 million. The Honorable Minister of Finance, that this budget also seek to correct many of the destruction that took place in the last 5 years. And the hinterland and the Amerindians did not escape those neglect or destruction. And therefore, when we came into office in 2020, what occurred is we had to correct some of the wrongs and begin the investment to make sure that the indigenous people and the hinterland were benefiting and that their lives and livelihood and economic activities were stimulated. And so this budget offers close to $5 billion, and the initiatives that we continue to work on are mainly work in progress. The transition of the village economy is important. That will generate employment, increase income, etc. And so the Amerindian Development Fund benefits in a way that will address economic activities, youth program, women, culture, and all the other things that we have been investing in, the human resource of the indigenous communities, the training of our young people. And so this year we have, for example, the CSO program, which was unceremoniously disbanded from the Amerindian benefits, that we have reinstated in 2020, and now this year we're moving from 2,600 young people being engaged at the village level, building capacity, supporting development in their own community, providing leadership, being role models, and also building competence in terms of the training they're receiving from us. We are now moving to 3,000. We'll be engaging 3,000 Amerindian youths. We will also be addressing the establishment and the continued establishment of garment construction and sewing units for women. You are aware that the government, under the Because We Care program, has increased the student per child to $35,000 and 5,000 uniform allowance. So many villages in the remote areas in the hinterland, they will not be able to afford to come down to Georgetown to purchase their uniforms. So we're establishing sewing units so that they can sew right in the village. They can create and provide that service to the student population, and the money that goes to the parents will circulate in the village. And obviously the women who will be engaged, not only women but youths and males also in that project, will continue to benefit from those. Agriculture, again, the mainstay of Amerindian sustainability is built around agriculture for food security, etc. We will be supporting them, complementing the Ministry of Agriculture in terms of promoting shade house agriculture. You know that Amerindians go very far to cultivate in the valleys of and the foots of the mountains and so on, but shade house agriculture is going to promote a new form of agriculture that makes it easy for single parents, women, and it will support village food security, including dormitories and also the school feeding program. So the money that are allocated to all of this will continue to circulate in the village, and that will help with income for farmers, income for women, and even the youths we are promoting in terms of getting involved in agriculture. So we have quite a range of activities taking place in the Amerindian village under the Amerindian Development Fund, both continuing initiatives and new initiatives. Training will form part of a major part of our work. We will continue to train in small engine repairs, tourism and hospitality training. This will be done in conjunction with the Ministry of Tourism, of course, and other major institutions that are offering such training. But the investment is basically to ensure that they build a skill set that is needed for the community and in the community.
Thank you very much for that. Very comprehensive. Minister Edghill.
Oh, not forgetting that we have 500 million for Amerindian development, Amerindian land titling, 500 million to continue the initiative of the ICT hut, which is being executed by the Office of the Prime Minister, and Hinterland Roads, $5 billion. So in a holistic way, we have addressed all of the areas that challenge hinterland and Amerindian villages and communities.
So the true allocation towards Amerindian development in a true sense is more than the $5 billion allocated through your ministry. There is allocation through other ministries that will go towards that community.
Yes, including education, health, upgrading health facilities, making it more accessible, services available, improved services, training of healthcare workers, teachers, etc. So the budget will cut across all sectors.
I'm glad you make those points before I go over to Minister Edghill, because just a few days ago I was engaged in a debate. As you know, Nigel Hughes put forward this so-called study to say that when you look at the regional allocation using the 2022 budget, that some regions are discriminated, and he looked at it from a racial lens. But if you really do a deep study, you would recognize that the regional allocation through the regional system, it's limited to under $1 billion. So to really understand the allocation at the regional level, you have to understand that all the regions have schools, all the regions have health centers and hospitals, all the regions have police stations, road networks, and so in every ministry you're going to have exactly agriculture, human security issues, and so in every ministry you have allocation of monies, allocation of public financial resources that will benefit
Exactly.
each region.
Exactly.
Each region, yeah.
Right, so I'm glad you made those points, and you used the term cuts across all region. That is very important
All
to
sectors
understand.
within the villages and communities.
Right. So, Minister Edghill, your portfolio, your ministry is, for me, the most important ministry, because the real growth and prosperity of this country is hinged upon the infrastructure development. And again, I have to go to the opposition leader, because I was listening to him just before I came, and he said that, he talks as though he speaks, he presents poetry. He says that growth is not development. That he may be correct as though he speaks, arguably, but to understand the reality of our growth. Now, he may be correct, arguably, but to understand the reality of our growth, the reality of our growth in GDP is such that Minister, you have in excess of $80 billion by the development that is taking place, and especially in the infrastructure sector. So, Minister, you have in excess of $80 billion, I believe, allocated through your ministry for major transformational infrastructure. So, could you talk to us about that?
Your figures understated, I must indicate. I have close to $150 billion in my capital budget.
I stand corrected.
But Joel, before I go directly to deal with what is happening in public works, let me deal with the budget as an overall. Because when a budget is presented, and this is it must support, and it must support and make clear what are the plans, the projects, and the policies of the government. We were elected when we said to the Guyanese people, put us there, and these are the things we will do to benefit Guyana. The first thing I would want to say tonight, Budget 2023 continues to show that the PPPC lives true to its word, and they're fulfilling their promises. They are advancing the programs, the policies, and the projects that we said we will do. So if we just go across the board with the measures, we're making life easier for people. Interventions, and that could have missed some people, because interventions that were made in short term in 2022 because of the elevated prices of fuel and food and the cost of shipping and the rest of it. The interventions that were done to cushion those effects in 2022 now stand in 2023 as policy measures to continue to alleviate the suffering of people. Car ownership, when I was a younger man, maybe the age of my sons now, only government ministers and permanent secretaries and very high officials could have owned a car. Now people who work in ministries and in private sector, maybe at the lowest level, office assistants, clerks, are owning their own car. We are making car ownership more affordable by reducing the cost of duty by 10% downwards. So you're going to be paying 10% less in duties on a car of 1500 cc or under. Now, if the car is a new car, if the car is an older car, you save less. Now, in public works, and what people might want to say, oh, the Ministry of Public Works gone with the hog of the budget. The Ministry of Public Works supports every other sector. What the Prime Minister has to do in terms of ICT connectivity, he has to be able to get to those locations in the hinterlands. We got to provide the roads. What Minister Anthony has to do in terms of delivery of health care, he has to be able to get across the country. What Minister Vindhya Persaud got to do in terms of delivering social services and taking care of the vulnerable and all the rest of it, we have to be able to have the infrastructure that supports tourism, that supports education, that supports Amerindian development, that support overall development. And what we see in Budget 2023 is bold calculated and strategic initiatives to support Guyana's development for the future. Now, not every year you will build a Demerara Harbor Bridge, or not every year you will build a highway from Palmyra to Molson Creek, but those are things that are necessary now. Once you do them now, you free up money to do other things in other years to come. So you have to be very strategic and bold in your initiatives. And yes, it is true that the Ministry of Public Works has a significant increase in its budget allocations, but these are bold and strategic initiatives to support a rounded development in Guyana. We have to link hinterland with coastland. We got to develop our aerodromes. We got to develop our road network. We got to support agriculture, so the farm-to-market access roads got to be built. We have to support delivery of services. There's going to be expansion in housing. We got to deliver 50,000 house lots to the Guyanese people based upon our manifesto promises. Those lands have to be developed. We have to get roads. We have to be able to get connectivity. People must be able to get to work and get home. We have to reduce travel time. The ease of doing business must be improved. So when you look at what Minister Ashley Singh delivered as a document, that framework in which we'll be operating over the next 12 months of implementation, it is rolling out to the next level. A foundation has been laid. We have reversed the hardships that the people have had. We've started to put in strategic things to improve lives. This budget will bring further improvement of lives now, but it's also laying a foundation for what will be for the future. So I'm extremely satisfied and gratified that in all of the proposals that were made and the considerations that were made, fiscal space was found to do certain things. And I would want to take this opportunity to publicly applaud President Ali for his visionary leadership, and Vice President Barjagdio, who interacts very heavily with my sector in terms of public works, in terms of giving guidance and strategic positioning, for the inputs that they have made and the decisions that they have made in guiding the Cabinet and the Minister of Finance in terms of making these allocations. Not just us today will be better, but our children down the line will be better. When we connect that road to Brazil, it's not just a road where you could drive and say it's a nice road, but you're opening up a market just in Roraima, the state of Roraima alone, of another 20 million people. Your market in Guyana is less than 1 million. And a road, a strategic road, Linden to Lethem, over the Takatu Bridge already built, opens you up to 20 million just in northern Brazil. As you go further, it opens up you up to South America. The bridge across the Corentyne River provides us with a framework in terms of oil and gas development. Suriname is going into oil and gas. A deep water harbor at Berbice, a 4-lane highway connecting with a bridge across the Corentyne River makes Guyana will be able to do for Suriname what was actually happening with Trinidad towards Guyana when we started the oil and gas sector. Because once you got a deep water harbor here, you're able to serve the oil and gas in both countries. It improves tourism, the possibility of building it out. Cruise ships could start coming together. And anybody who've traveled in the Caribbean knows that it just takes two cruise ships to dock. And what happens in the market? The sales go up, 6,000 people come off board, spend 12 hours or 8 hours, depending on what they do in an island. It makes a significant difference. Agriculture, we have to build out the stellings. We have to be able to get the produce out of the various areas. We have to be able to get them to market. We have to improve airlift to the Caribbean, to North America. We have to be able to provide that link. Guyana must be that hub to link the Caribbean with South America and provide that service. So we are building in that framework and we're building it out. So the money may sound plenty, and to some people's minds, last year I said you can't eat roads, but roads make you eat. And people are realizing that now, when we have the roads, people could really eat because they can do so much. Now that we are building out the infrastructure, it will make life better for everyone. I'll pause here for now.
Thank you. That's very direct and I'm glad that you've elaborated on the indirect impact, and you mentioned the Deepwater Harbor would not only serve, I want to add to that, it would not only serve the oil and gas sector, but imagine as we start to grow in terms of the status of our wealth as a country, per capita income will start to grow, which means the income per household will start to grow. People will earn more money at the household level, which means consumption increases. When consumption increases, international trade, shipping, commerce increases, and so you need that Deepwater Harbor to also facilitate the regular commercial activities in international trade. So some very important points, Minister. Dr. Frank Anthony, the health portfolio, your ministry would have gotten a sizable allocation of $84.9 billion. So tell us about some of the major projects that we can expect with this allocation.
Well, thank you very much, Joel. But just like my colleagues would have said, I think this budget is guided by our overall vision of where we want to take Guyana, while at the same time trying to fix some of the immediate problems. We have seen that when we came to government, we came with a manifesto that first and foremost we wanted to fix things in different sectors, because having canvassed people, we knew what they were looking for. And so I'm very pleased to see that we have been systematically trying to get to those objectives. So when we look at things like in education, we've been able to restore that We Care grant, which is so important to a lot of families around the country. That has made a tremendous difference to people. And every year since we've been back in government, we have been increasing that grant for people, and it has brought a lot of relief. We have aimed in all of our budgets to address people. And in the health sector, we've had that opportunity to really provide a better quality of health care. In the public sector, we have more than 420 different facilities. And we feel that some of these facilities, especially at the hospital level, it's not enough. And one of the discussions we've had is how do we improve hospital facilities? So you would see reflected in this year's budget, we have 6 new regional hospitals. We have already awarded those contracts last year, but you'll actually see physical construction this year. So you'll see a new regional hospital at Anna Regina, a new regional hospital at the Kendron in Region 3, 2 regional hospitals in Region 4, one at Diamond, one at Enmore. A new regional hospital in Region 5, that would be around that Bath area. And another regional hospital at number 75 in Berbice. In addition to that, we have also allocated money in this year's budget to do substantial improvement in a number of the hinterland hospitals. So Latin, for example, would have a major upgrade, Mabaruma, Maruka. You would see us upgrading the hospital at Camarang, Keto. We'll be building a new hospital, Madhya. We'll be improving that hospital as well. And while we are doing all of that, we're also going to do a brand new hospital at Bartuka. So over this year and running into the next 2 years, you will see a total transformation of our hospital infrastructure. You would also see us build new referral hospitals because, as you would have heard the President saying, that we want to aim to become a world-class provider of healthcare services. The only way we'd be able to do that, we have to build more level 5 hospitals. And so we're starting with the Maternal and Child Health Hospital, a 256-bed hospital that's going to be located at Ogle. We have already identified the site. Work is ongoing at the site, and you will see a substantial bill out this year. That is going to be transformational. That hospital is being built to European standards, and we'll have a lot of the subspecialty for children who get sick. In addition to that, all our high-risk mothers would be going there. That hospital would have a cardiac theater, for example, so pediatric cardiac surgery that we need to do right now, we cannot do them. We have to send the children abroad. We'll be able to do all of that right here. And you would see us build out other types of facilities that would be at level 5. Now, one of the things that we will also be doing is to make sure that we can improve waiting times for people. We want to make sure that we do that by using technology. So later this year, we'll start putting in the infrastructure to do electronic health records. We'll be going to Parliament to address the legislation to make sure that people's records are held properly and confidentially. So you will see a total rollout of systems that would allow for faster access of records, but at the same time to maintain people privacy with these records. You would also see us use technology in a different way for diagnostics. So a lot of our medical imaging, we'll be moving to digital medical imaging. So all of our x-rays right now, we're converting them into digital imaging, CT scans. We'll be getting new MRIs, mammograms, and so forth. And we're building out that type of resource. We'll also be using teleradiology, so interpretation can be done at one center. We'll be doing telepathology, which would turn around the time that we have to take to analyze samples. We're also doing tele-ophthalmology, where we can examine people's eyes and get an interpretation. And all of this will be linking to the interior of Guyana. So a lot of the sites that I talk about, the hospitals, they would be equipped with the right equipment so that we can do all of these things, and connectivity, so that the standard of care that we'll have on the coastland would be the same standard of care that you will have in the hinterland. So what you are seeing over the next couple of years is a total transformation of the health sector. And we'll be, apart from doing a lot of the primary health care things in terms of diabetes and hypertension and so forth, we're making a paradigm shift where we try to keep people well so that they don't get sick. And if they get sick, then they can get the right care. And so that's something that we're working on, strong primary health care. And you would see us this year changing a lot of protocols, introducing newer, more effective medication for a number of the diseases that are more prevalent among Guyanese. So in a couple of years, you will see a total transformation of the health sector, keeping with the President's vision of a world-class healthcare system. But I'm sorry, we don't have enough time to delve into all the details.
I want to, before I invite Dr. Ramsarran to contribute to the health sector, I want to share a personal experience right now that is happening right now with a relative of mine. The investments in the healthcare sector over the years, while we have this far to go in terms of transforming our healthcare sector to a truly world-class healthcare sector, I think and I'm glad I have this opportunity to say this among the presence of the Prime Minister and the ministers here. I think we need to take the time also to appreciate that the investments that we've made over the years are starting to yield their results. Because right now, as I sit here, I have an example that I can share with the people and you, that a relative of my wife, her aunt, got living in the British Virgin Island, and got a baby, 3 months old, born with a whole set of complications and needed to get a special surgery done. And the only place she could get a surgery done is in Guyana. Flew to Guyana. She went to a private hospital. She got more complicated. The private hospital didn't have the type of equipment and care, and she's at a Georgetown Public Hospital. So I think that is something that we should pause and appreciate, that we're seeing the results of this type of the investment that we're making and where we are taking our health sector. We have to build a health sector not only to cater for our people here in Guyana, but for the rest of the region. So that people, years ago, we have to go out to get things done. Now people are coming here. So that is very commendable on the part of the government of Guyana.
One of the things that I think people don't realize is that we have one of the best neonatal care services in the country. And even, I would say, even in the Caribbean. We take some of the most complicated babies and we were able to treat them and work with them. And that is testimony to the type of training that we've been able to do here. But apart from the primary health care, we are also doing very sophisticated care here in Guyana. So just about a month ago, we did 57 joints, knees and hips replacement. So, we're doing all kinds of complicated surgery, including kidney transplants. We're doing cornea transplants. So the level of care that we can provide here is improving, and we're doing lots of complicated cases. If, for example, you have to do a kidney transplant in the U.S., it would cost upwards to about $500,000 US. We do that here for free. And so there are lots of things that we are right now doing, but we are going to be expanding that. And we want to get the fundamentals right. So that's why we're investing a lot into primary health care.
Dr. Ramsarran, you want to add anything in the health sector?
Yes, there's so much more we can add, and I'm certain Dr. Anthony can go on for hours. You put it well. People are coming from overseas to get treatment here, which we thought, or the general public did not know exists in Ghana. They think it's first world stuff. But I like to do this. Ask ourselves, where did we come from? These things happening. When we first took over in 92, 93, we had 157 doctors in this country, predominantly in the coast, if not almost all, and in private hospitals, or moonlighting in private hospitals, from the Charlton Hospital. Now, you see this year we bring 52 more doctors. 52 more doctors. There's a plan for human resource. The best hospitals you have, the best intentions you have, cannot translate into services if you do not have the software, the brain power. So that's the main thing we got to look at. We're having more doctors in more places at any time and with more specialties. So the patient sometimes doesn't have to come up to that level at the Charlton Hospital. They can get preliminary treatment, be prepared there for the upward mobility. That's why, and Dr. Anthony has strengthened this aspect of it, the referral system. It is a standardized, powerful system. Therefore, the patient they can pass through the system by passing out a less sick patient and so on. So those are some of the things that we do have, and the personnel. And we've introduced in the last 10 years or so, and it's concretized here, specialist programs in Guyana. You have foreign students from the Caribbean who might have trained overseas in other third countries are now begging us to allow them to come here to do the internship. In some cases, and that's how we
postgrad studies.
Exactly. So we now allow them to come here to do the internship out of the Caribbean. We say yes, come. They get the training, the doctors over there, but they don't have enough patients because they so many. So we give them that option of coming and rubbing shoulders here with us. So in that regard, training must never be forgot. Training at that level, but you have to get the support of not only doctors trained, the nurses, and I got to put a plug for the nurses here. Without the nurses, the doctors will not be able to do their job. And we've done great in that, starting over the past few years, and it's continued in this budget. The nursing school in Kingston, people take it for granted now. But previously, up to just 10, 15 years ago, we would be training 16, 17 nurses per year. Now we're training them even in the night. We have a night school. And you have to overcome a lot of resistance from the opposition elements, some more in Parliament. Night school, we go mad this. But if nurses can work in the night when they qualify, why can't they study in the night? So those are some of the innovations that the PPC introduced and has still carried, and they've proven they work. So I think I can shut to that.
I think one other major thing that we must bear in mind too is the increase in salaries that we're offering to medical workers. Starting from this month, the salaries have improved drastically. So a doctor who just graduated, let's say 3 years post-graduation, would now be starting at 450,000 Guyana dollars. A nurse a nurse, registered nurse, is now going to be getting $169,000. A nurse, registered nurse midwife, is going to get $219,000. And these are just some categories of workers, but everybody who is in the clinical aspect would benefit significantly from these salary increases. And as Dr. Ramsarran said, we are training a lot more people.
Certainly, I would have to reconsider my profession. Finally, Dr. Vindhya Persaud, coming now to your ministry, your sector, you've been allocated some 40 billion and change. So tell us about some of the programs and the major programs and the impact of it that you will be overseeing for this year.
Well, this is the Human Services Ministry, and we have gotten $40.4 billion. A hefty percentage of that will go towards the most vulnerable. That would be our senior citizen population, where the old age pension would have increased from $28,000 to $33,000. And this is a tangential increase that we would have seen. For the last 2 years, we had close to 40% increase in old age pension. We've exceeded that, and in comparison to the previous government, we have exceeded in this short period of time what they have not done in all of their 5 years for pensioners. But it's not only the old age pension. It is, again, the cross-cutting nature of the budget, where persons will benefit who are in their senior years from the healthcare services that are now going to be upgraded, escalated to cater for their many ailments or illnesses. And we're looking at an increase in life expectancy. Just to give you a picture of what has happened, we have noticed that the number of pensioners increased by approximately 3,000 per year. So we're projecting to cater for 73,000 pensioners this year alone. And the good thing, the people are living longer, and the good thing is that the pension is not means tested, which means all pensioners will benefit from the increase in the pension in itself. And that adds on to a number of good initiatives that we started in 2022, making the pension easier. You're not seeing those long lines at the post offices because now pension is paid every day at alternate venues. People can access their pension in the banks. People have pensions delivered to their homes as shut-ins. Those living in the hinterland have the direct delivery services where pensions are closer to where they are in the villages. So it's not only the pension, but how the access is given. We're going to this year be utilizing MMG to make pension more accessible. So this puts roughly 1,000 locations into the whole pot of how people can access pension. And when we look at that, it is $4.4 billion we're putting as income into pensioners' hands. Public assistance, this is looking again vulnerable people. Public assistance is temporary assistance, but it is divided into permanent disability categories, medical and economic categories. For permanent disabilities, last year, announcement made by His Excellency the President saw children benefiting from a $100,000 cash grant. From that exercise, we were able to develop a digital database of all children who are living with disabilities in Guyana. It's a first-time thing. And from that database now, we will roll out a series of programs to cater for those children, tapping into health and other sectors to help those children. So now those children will qualify for the increase in public assistance, well, the parents of those children indirectly, and also people adults who are living with permanent disabilities will benefit in terms of the public assistance increasing to $16,000. Again, this is putting $700 million in the hands of persons who are most vulnerable. And that's not all. The budget also focuses on the comprehensive overview when it comes to seniors. There are many seniors who do not have shelter. We cater for them, and now with $100 million, we're looking at an additional residential facility for seniors, and this will go a long way to catering for those persons who may have been abandoned. That is a serious problem, and I wish that would change, but it is a reality, and we're looking at the homeless, the indigent, and those persons who will qualify. Now, the other big population would be our children population. And again, emphasis is placed on ensuring their safety and security. And the child advocacy centers have been a welcome addition to what we do in terms of ensuring that children have the opportunity to tell their story when it comes to child abuse, child sexual abuse, once through forensic interviews. So the child advocacy centers are done in partnership with NGOs. These are across the region. So by giving over $100 million towards this partnership and the child advocacy centers, we are guaranteeing that children have a safe space where they can ventilate their experience and where justice could be served. And in addition to that, a novel initiative, something I've been very passionate about, night care. We often hear about daycare, but the concept of night care is a new one. It's the newest in the region, and I could venture to say perhaps globally. And this has generated a lot of excitement when I spoke about this at conferences overseas. And it came into being because I noticed a lot of women, and men too, work long hours. A lot of women are always searching for a safe space for their children, especially when they have to work into the evenings. So the day and night care concept blended with early childhood development will materialize this year. And we have over $100 million towards that initiative. And I think that blended with the Winning Initiative, which has trained thousands of women, started off as a pilot in 2020, which is the latter part of the year, morphed into 2,000 women, then over 5,000 women last year, and we're aiming for over 6,000 women this year. Many of those women, and men too, because we never turn away the men. Men are part of that. The women and men have been trained in child care, and we're looking at further training in special needs. So when these persons have completed their training, they have the opportunity to staff some of these day and night care facilities and also form consortiums where they can get into micro-enterprise, which the WIN initiative also facilitates through the WIN in business clinics, to starting entrepreneurial type of ventures so that we can have more options for parents out there. It's focused on the parents and the single parents as well. And there are a number of key initiatives that will focus on women, on men, on young people. And I hope that as I detail them in the budget presentation, people will understand the impact that they will have not only on the coast, but in the hinterland. The WIN program for the first time has trained hundreds of persons in the hinterland in things like patient care, elder care, child care, and I'll be working with my colleague on a home-based care venture where these persons can be part of his referral pathway when it comes to patients going home and needing home-based care. So these persons are now equipped with the skill. So what we have done in the government's vision is look in a very holistic way at the needs of people across the country, whether they are persons who are healthy and they are part of the labor market, like the WIN program gives them the opportunity to do, or they're persons who have health concerns, not only in the institutions, but the aftercare, what happens when people head home.
Thank you for that contribution, and I'm glad that you took some time to explain the public assistance program, which is, from my understanding, it's a relatively new program introduced by the government.
No, actually, it's not a new program, but it's a program that has been expanded. There have been unprecedented numbers of persons who have benefited from public assistance under this government. In fact, last year we saw almost 29,000 persons. When I got into office, we were looking at 16,000, 17,000 people getting public assistance. Look where we are now. So it just tells you the magnitude in terms of the numbers of people who we have been helping through public assistance, and we will continue to help, because with the announcement made by His Excellency where people with permanent disabilities will be on public assistance for a long term, and then further the policy direction taken by me, it means they never have to apply other than one time. So it removes the hassle. Once you're on the permanent disability list, that's it, until you transition to pension. So that's brand new.
Yeah, so right. So it is expanded to benefit thousands of people more. Thank you all for your contribution. I just want to connect a few dots. In closing, and Prime Minister will ask you to say a few closing remarks before we go off air. My closing point I want to connect is starting from Dr. Ramsarran, where you went back, something which I often do when I speak publicly, where we came from. We came from bankruptcy. And I'm saying this in the context of the popular criticism by the opposition leader, speaking of, this is a multi-billion-dollar budget, we're drawing down billions of dollars from the oil fund, and we're only allocating a few $1,000s increases to pensioners and so on. But you've explained, your ministry has gotten $40 billion. And Minister Edghill made an important point that I want to connect. Where these capital projects, these capital investment in the infrastructure are necessary, but we're not going to do it. We don't need 10 gas plants. We don't need 10 bridges across the Demerara River. These are investments that we have to make now because they're part of the framework that will enable sustainable development. Because where does this funding for social program comes from? It comes from taxes generated from the productive sectors of the state, of the economy. And therefore, we have to invest in the infrastructure. We have to build the roads in the farmer market. We invest in all of these infrastructure to support that so that the future economy we can now have, when we don't have all this big capital budget, we will have more resources to allocate to the social program. So with that, I want to conclude my closing remarks, but I'll ask Prime Minister to give final closing remarks and then we go off here.
Oh, thank you. We have to understand that with this budget, there are several gaps that we try to cover and to close. You've heard a lot about the economic sector allocations, the social sector allocation. Even though I am not the person to speak on it, another important sector allocation is that deals with security and safety. And a sizable amount of money is allocated to improving the social, the economic, and the security sector aspect. We are improving the way how we deal with our prisoners. We're improving the installation of the facilities and the resources that goes to firefighting, right? Building a fire station, building the headquarters. We're improving the Guyana police force in terms of the equipment that they need to respond to whenever there's some crime or some emergency. Civil Defense Commission, right? We're improving the manner in which they respond to times of disaster. So all of that is included in the budget. Another important part of the budget is the whole issue as to how we deal with climate change. And our projections in terms of honoring our responsibility, not only to the region, but to the world, in making Guyana a more climate resilient country. You heard about, and you probably know better than I do, about the Low Carbon Development Strategy 2030, where, from a strategic standpoint, we're working towards not only investing in transitional energy, but also being more transformative in moving Guyana away from non-renewable to greater use of renewable energy. And that is enshrined in our LCDS 2030, whereby 2030, 60% of the energy that we're using will be from renewable sources. Now, the investment in the energy sector also is people-centered, because not only are we investing in a mega project like the gas to shore, but also we are investing in ensuring every household in our hinterland have some form of energy device that they can charge their phones that they can have some amount of lighting wherever they are. So we have a project where we're bringing 30,000 solar panels to be distributed to over 200 hinterland communities. We have an ICT connectivity project where, as you heard before, we not only constructing the hubs, but we're connecting over 200 communities to the internet. These are all important projects to ensure that Guyana develop in an even manner. And why do I say in an even manner? Not development on the coastline alone, but also development on the hinterland. So we're bridging the ICT divide, we're bridging the energy divide, we're bridging the infrastructural divide, we're bridging the education divide, we're bridging the health divide, you know, as it pertains to life on the coastline and life on the hinterland. And Minister Dr. Vindhya mentioned this whole issue of using MMG to provide the payment of social sector pensions, etc., to people wherever they are located. So we're using technology to bridge the divide that exists between life on the coastline and what obtains in the hinterland. So this, I will conclude by saying, this is a people-centered budget. There's a lot in the budget here. Anybody, who spend the time to peruse the budget, to study the budget, will realize that there are a lot of measures in the budget that will help the business sector. There are a lot of measures in the budget that will help the people of Guyana, the ordinary people of Guyana in their households, wherever they are located. This is the budget that will carry Guyana forward. For example, this is the forest budget that we're using money from the carbon credit. And you notice this year it's toward $1.3 billion is coming into the budget from carbon credit that we earn. Okay? But what is important, we've made a commitment that 15% of what is earned from the sale of carbon credit will go towards the indigenous people of Guyana. So in this budget, for my quick calculation, some $4.7 billion is going towards the indigenous people of Guyana, simply from the sale of toward $1.3 billion that we receive in this year alone in carbon credit. And that will go on for another couple of years as we continue to sell carbon credit. Okay? The $208.9 billion again this year is coming from the NRF. Right? So yes, you see the budget grow from 500 and something to 781. But the growth that you see in that budget there, the money mainly will be expended on the strategic projects that will, I don't want to use a hard term like catapult Guyana, but to continue to see the accelerated development that His Excellency the President keeps talking about Guyana, right? The accelerated development. We are on a trajectory of development, and we're spending the money now on these mega projects that will take Guyana forward.
Prime Minister, thank you very much. Ministers of Government, thank you very much for your time. I know it's been a really hard day today with the budget presentation and all that. It's 10 o'clock. It's after 10 o'clock. So viewers, thank you. That's it for our post-budget presentation and discussion. Thank you and good night.
Good night.
Thank you.